What are the deadliest diseases and what is it like to die from them? This week, we're going to be talking about metastatic breast cancer. In this video, I'm going to be talking about what it's like for people who are at end of life with breast cancer and some of the myths about breast cancer. So 1 in 8 women will be diagnosed with breast cancer in their lifetime. So breast cancer is huge in our population, but it's important to know that there are many different types of breast cancer. And by the time I see them on hospice, it's usually been a very long road. Now, not all types of breast cancer will lead to hospice. I suppose any of them could, but the one that I see on hospice the most, and it's usually been, again, over a long period of time by the time they get onto hospice to see me, is triple negative breast cancer. Also, it's good to remember that most people who come onto hospice with metastatic breast cancer is because it's metastatic. It has moved to multiple other places in their body. They have received many surgeries, tons of different chemos and different radiations. So by the time they see me, they've gone through a lot. Because breast cancer is so common, and all different types of breast cancer are so common. My mother had breast cancer many years ago. She has been 7 years cancer-free. I want to go over some of the myths that people think about breast cancer or pass around. I know I've heard some of these myths, so I want to make sure we clear those up. I think this is important to know that all of this information I'm about to say can be found at nationalbreastcancer.org. So the first one, a breast injury can cause breast cancer. I can really remember hearing this as like a teenage girl, that like if you hit your breast really hard, it may cause breast cancer. This is a myth. It sounds pretty obvious now, but I can remember hearing that back in the day. Here's a good one. Breast cancer is more common in people with bigger breasts. Myth. This is not true. Any breast size can get breast cancer, and men can get breast cancer. The next one is a definite sign of breast cancer is breast pain. So interestingly enough, a lot of times people do not have pain with breast cancer initially. Oh, this is a good one. Consuming sugar can cause breast cancer. This is false. Okay, so let me read this to you. While sugar isn't known for its health benefits, it does not cause breast cancer. Many doctors and health experts encourage patients to reduce or limit sugar intake because it's addictive and can contribute to mood swings, obesity, and illness. Weight gain, obesity in particular, are risk factors in developing breast cancer and many other types of cancer. However, sugar itself does not make cancer develop or help tumors grow. There we go. Myth expelled. We are all learning something new today here, folks. Oh, this is a good one. Carrying a phone in your bra can cause breast cancer. I have definitely heard this. Not true. Your phone in your bra is not going to give you breast cancer. Bras with underwire can cause breast cancer. Myth. These are honestly things I can remember hearing as a teenager. So even though it seems a little obvious to me now that this is a myth, I think it's still good to make sure everyone is on the same page. However, I don't like underwire. Just generally speaking. And remember, men too are affected by breast cancer. Of course, women are affected more, but men can get breast cancer. Oh, this is a good one. Deodorants cause breast cancer. I have definitely heard this, and I want to read this. So let's see. According to the American Cancer Society, there is no conclusive evidence linking the use of underarm antiperspirants or deodorants and the subsequent development of breast cancer. Also, some breast cancers, remember, can be genetic, and some are not. So just because like my mother had breast cancer, it depends on what kind of breast cancer you have that shows if it could be a genetic link or not. Okay, so what have I seen as a hospice nurse with my patients who come onto hospice with metastatic breast cancer? Now, most people with breast cancer that I have seen are women. But like I said over and over again in this video, men can develop breast cancer. What I normally see with people who come onto hospice with breast cancer is that it has metastasized to their lungs and their brain, usually. And like I said, it's usually been a very long journey for them to come onto hospice. The main symptoms I see are pain, shortness of breath, and confusion, because the cancer usually has gone to their brain. It is usually younger women, I would say 40s, 50s, 60s. It can be complicated because of that reason. So I actually don't see many metastatic breast cancer patients on hospice. Part of me thinks it's because many of them are young and they are not introduced to hospice, or it's looked down upon to go on to hospice, so they don't. They end up being in the hospital and possibly dying there. We can manage your symptoms. Like I said, the main symptoms are not great, but they're not hard to manage. Does that make sense? So yes, there's pain. Yes, there can be confusion, sometimes seizures because your brain's involved. So there are symptoms we have to manage, but it's usually not things that are very complicated. So they can be easily managed with medication. A lot of times we'll see many patients with metastatic breast cancer who are on steroids. The steroids help with inflammation. They decrease the inflammation. That helps with pain. We can get their pain under control. We can get their shortness of breath under control if they have shortness of breath. A lot of the things we manage are the family dynamics, because like I said, they're mostly women and they're younger, so they might have children. Their husband's trying to be their caregiver. It's hard for them to let go. There's a lot of existential, emotional suffering. So we try to bring in our whole entire hospice team, not just the nurse, but the home health aide, the doctor, the social worker, the chaplain, everyone to come together to help the family as a whole, as this person processes and goes through their end of life journey. Now, people with metastatic breast cancer are going to be doing the same things anyone else during their end of life journey will be doing, which is they'll have a functional decline. So it's not going to be easy for them to get out of bed and go to the bathroom. Eventually, they won't be able to do that at all. But if they can come onto hospice early enough, right? If they choose hospice early enough, again, their choice, but they can really live out the rest of their life. We can manage their symptoms so they can still be up and doing things with their family, with their friends, going out, doing what they want to do. And as their disease progresses, like it would for any disease, right? Functional decline, mental decline, poor food and water intake, sleeping a lot, that will slowly go on as their disease progresses. And we would try to help that family as much as we could during that time. So there'll be the common things we see, right? Sleeping a lot, not eating a lot, not drinking a lot. We're going to let those things happen naturally because that's the body's natural way of shutting down. Now, particularly with cancer, a lot of times people will have a rise in calcium, which is actually a good thing because that helps them be tired. It helps them sleep a lot. So sleeping a lot, not eating and drinking, sleeping a lot, not eating and drinking. That's helping the body shut down naturally on its own. And again, like I said, the main symptoms I see would be confusion, pain, shortness of breath sometimes if it's in the patient's lungs. And again, all of those things are easily managed with medication on hospice. Breast cancer is more prevalent in women. Men can get it for sure, so I'm talking to you too. But I will say the majority of people on my channel, watching my channel, are women. Early detection for breast cancer is key. So talk to your doctor about mammograms, about ultrasounds, if you have dense breast tissue like me, monthly breast checks on your own. There are a number of resources that you can go where they can actually show you how to give yourself a breast exam and the signs to look for anything abnormal to point in the direction of possible breast cancer. Early detection is key.